Good morning. Welcome you all to our course Radiation Oncology Physics, and in this week we are discussing the brachytherapy of which is a very important part of radiation oncology, and today's class is lecture number 24, and in this class we are going to discuss the dose specification of cervical intercavitary brachytherapy. This class is purely dedicated to the dose specification of carcinoma cervix intercavitary brachytherapy. As I have already mentioned in the last class that there is almost 25 to 30% cases in India we are seeing from the carcinoma of cervix, and they are curable disease, and this disease carcinoma cervix is treated by brachytherapy as a monotherapy, means the treatment is done by the brachytherapy applications, but in advanced disease we apply the external beam radiotherapy or means teletherapy or and brachytherapy in combinations, and this combination is done as per the stages of the disease. And so there is a very accurate and very robust dose specification system we need for the treatment of brachytherapy of cervical cancer. Now, learning objective of this class is just dose specification of intercavitary brachytherapy for cervical cancer, and they are in this category we will discuss the milligram hour system and the Manchester system and ICRU 38 system. These are the system available for dose specification of the brachytherapy. Also there are some more advanced systems are available which or protocols are available for dose specification of brachytherapy of carcinoma cervix. Now we will here we will discuss only these first three type of system. First one is the milligram hours system, and second one is the Manchester system, and third one is the ICRU 38 system. Now, dose specification system milligram hours, this is one of the oldest system of dose specifications, and in this is the milligram hour dose specification, and it is used during the preloaded era, where in that time when we actually we used we were used to the preloaded type of applicators for the brachytherapy. And milligram hours means it is the product of total source strength and the implant durations, means the amount of source we have applied for brachytherapy and the time of implant, how much time we give this put this keep this applications in the patient body. So, this is the milligram hours. Milligram means the amount of activity and hours is the total duration of the implant. Now, these milligram hour dose specification are based on extensive clinical data on any particular type of applicators, source loading type, means what is the ratio of source in intrauterine canals, and the what is the distribution of source between the intrauterine canals and the vaginal source, vaginal applicators. So, they are very much specific to the applicators, the source loading and the implant duration of various stages of disease. For example, they have given the Fletcher guideline, and which is guideline is based on the experience of the MD Anderson hospitals, and this is actually very much used guideline which earlier days we used for the treatment of carcinoma cervix. And demerits of the this type of dose specification is milligram hour type of dose specification is dose specification by milligram hour alone is not adequate. It is very much understood. There are many things which should be taken into consideration during the dose specifications. They lack the informations on source arrangement, how the source are arranged, and the position of tandem relative to the ovoid. this is a very important point which needs to be considered during the dose specification. There is also lack of information of packing. They also lack information of tumor size or disease. These dose specification is not actually disease specific, and there is no information of patient anatomy. So, these are the very important information which lacks of this type of dose specification system of milligram hour type of dose specification system, and it is earlier days it was used, but it is not used nowadays, and we progress towards the more specific and robust dose specification system. Now, the next dose specification system is recommended by it is known as the Manchester system. It is known as Manchester system, and this dose specification system is most extensively used system, and even in the age of computer and most sophisticated algorithms are used, we are used for treatment of cancer patients, but still we are using this Manchester system. And these Manchester system, they have the basic features. They have mentioned the point dose. Some they have given some point, and which are very much important to understand. They have given 4 points in their system. First one is point A, second is point B. These are 2 points which the first point A, this is actually mentioning the target volume, target dose, and point B dose is the dose which is describe the dose follow up beyond the implant target volume. And bladder point and rectal points, we know that in cervix, in there are superficial, in the above there is a critical structure bladder, and after that we will have a rectum, and these two structures are very much important while we apply the brachytherapy for carcinoma cervix, because any kind of complication of these important structures is very much problematic for the patient, for their to maintain their good quality of life. These are bladder point and rectal point. So, we need to specify these 2 points, as well as we define the target point dose, and we will define the how this implant dose is follow up beyond the implant area, beyond our target volume. And duration of the implant is based on the dose rate at point A, means you actually prescribe the dose rate dose at point A, and we divide the dose rate at point A. So, we will get the duration of the implant. This is the system, actually Manchester system gave us, that is 4 points, and they mentioned that we need to prescribe the dose to the point A, and dose to the other point are also taken into considerations, means other points means point B, bladder point and rectal points. These all points are, those are very much important to define any kind of applications, means our application is good or not, it will defined by these 4 point dose dose. If we mention this point A dose, it is actually target dose, and point B, it is the dose follow up, and bladder point dose and rectal point dose. So, these are point dose we need to mention for the brachytherapy application of carcinoma cervix. Now, coming to the point A, this is a very important point, as I have already mentioned that we prescribe the dose in the point A. Now, we have many definition, and the point A's definition is modified from time to time, and they are redefined by many researcher, and these are some definitions of point A. Point A is the 2 centimeters superior to the vaginal fornices. This is the first definition. This is the first definition, 2 centimeters superior to the lateral vaginal fornices, and this is vaginal fornices, and 2 centimeter lateral to the cervical canal and in the plane of uterine cavity, because we know that there is a particular plane is there for uterine cavity, and this varies from patient to patient. So, first definition says us that 2 centimeter superior to the lateral vaginal fornices and 2 centimeter lateral to the cervical canal and in the plane of uterine cavity. This completes the first definitions. Now, second definitions is they have seen that it is modified that as 2 centimeter superior to the cervical os and 2 centimeter lateral to the cervical canal in the plane of uterine cavity. So, this is the final latest one which is defined the point A. So, now we can use the point A is the point, it is 2 centimeter superior to the cervical os and 2 centimeter lateral to the cervical canal in the plane of uterine cavity. Now, what is the anatomical importance of this point A? Point A is located where the uterine vessels cross the ureter, and this point is very much sensitive to the dose, and tolerant we can limit the tolerance dose as so that the tolerance dose of this structure is the main limiting factor during the irradiation of carcinoma cervix. So, we define or we prescribe the dose in point A, and there are some limitations are also mentioned by various critics, that it relates to the position of the source only, not to the anatomy of the patient. As I mentioned that it is cervical os and cervical canal. So, point dose to point A is very sensitive to the position of the tandem and relative to the ovoid. This is the very important parameter while we planning our tandem and ovoid type of design. When we are applying tandem and ovoid type of design, we need to mention the position of tandem relative to the ovoids, and depending on the size of the target, point A may be inside or may be outside. Means if our target is bigger, the point A may be the inside. So, the whole target will not get the if our target this is actually give rise the 100% of this our distribution goes like this. So, this is the dose distribution, and this is 100% isodose line, this is 100% isodose line which passes through the point A where we prescribe the dose. Now, if our target volume is larger, if our target volume is larger than the point beyond the point A, suppose this is the target volume. So, this volume also will not receive the 100% dose, and if our target volume is lesser, then also this point A is giving the overdose to the this our target, and this the normal structure will receive the 100% isodose. So, this is not desirable, and this is the most important critical point of point A, that this point A may be inside the target or may be outside the target. For big target, it will be inside the target and it will underdose some malignant tissues, and if it is a small target, then it is overdose, it will give the excessive dose to the normal tissues. Now, point B is, it is defined as in the 3 centimeter lateral to the point A. Here is we have point A, and this is 3 centimeter lateral to the, this is 3 centimeter lateral to the point A. So, we have, as we have 2 point A from right lateral and left lateral, and similarly we have a 2 point B, and they are 2 centimeter above the external os and 3 centimeter lateral to the point A. So, this is the definition of point B, and this point B dose is represents the dose follow up of the implant applicator of this specific implant. Now, bladder and rectum points dose are depends on the distribution of the source, and if we apply the high activity to the tandem source intrauterine intrauterine canal, then we will get a high bladder dose. But if we place the high amount of dose to the ovoid, then we will get a higher rectal dose. So, we need to adjust all these radiation dose distribution or distribution of source such that bladder dose and rectal dose should not exceed their tolerance dose. Now, if how we will get these bladder dose and rectal dose, we can have a accurate information about bladder dose and rectal dose before the application of radioactive isotope by the measurement or by the calculations. In the if we get these measurement the higher bladder or rectal dose, we need to alter the source, we need to have changes or alteration or modification of source distribution, so that this bladder dose or rectal dose comes under the tolerance dose. And measurement we done by the ion chambers measurements, they are placed directly inside the rectal or inside the bladder, so that we can get the actual reading, actual dose to the bladder point and rectal point. We can also have an idea or accurate information of bladder or rectal dose by calculations, and because by the calculation we can localize these bladder and rectal structures by radiograph. We can apply the contrast to see the bladder and rectal point very distinct in very distinct way. Now, the limitations of the bladder and rectal dose, the maximum dose to the bladder point or rectal point, that 80% of the prescription dose, means bladder and rectal point should be less than 80% of the prescription dose of the prescription dose which we have mentioned in our prescribed in the point A. So, bladder and rectal point dose are very much important, and if there is a excessive dose to the bladder and rectal point, we need to alter the source distribution, so that we can get a dose which is under the tolerance dose of bladder and rectal point, as bladder and rectums are very much radio sensitive, and their complications or radiation complications are very much painful for the patient. For to maintain their quality of life, we need to control this bladder and rectal dose for the brachytherapy applications. Now, coming to the dose specification of ICRU system 38. These ICRU system first recommend the dose distribution to the target volume, and in Manchester system we have seen that they are dose prescription in the point. So, in the ICRU recommendations, they prescribe the dose distribution to the target volume, and dose prescribed as the value of isodose surface that covers the target. So, we that just confirm the targets. So, we prescribe the dose isodose surface, it is maybe the 100%, maybe 90%, where we can prescribe the dose on the isodose surface. So, ICRU system of dose specification includes, we need to record all these things, means first we define we should clearly define the technique. In the technique, we have applicator type, which type of applicator we have used, we need to mention the source type, we need to mention the loading distribution, even we need to mention the packing of the packing information. These packing are done for to give the space of rectal, bladder, and we need to fix our applicators within the body cavity. So, we use the packing. So, these are the things which need to define the, which needs to record these information should be recorded to definition the technique of the applications. These are applicator type, source type, loading distribution and packing of the packing informations. We also need to record the total reference air karma. This is the total air karma strength of the source multiplied by implant duration, as we have mentioned that it is similar to the milligram hour, where milligram is the amount of activity and hour is the duration of the implant. Similarly, here also, as nowadays we are specified the radioactive isotopes in air karma strength. So, total air karma strength of the all the source is should be multiplied with it will be multiplied with the implant durations and it will give the total reference air karma. This is, as I mentioned, this is similar to the strength of milligram hour, and the unit of this total reference air karma is microgray meter square hour inverse. This is the unit of total reference air karma, microgray meter square hour inverse. So, ICRU system, it gives us the first recommendation which gives us the dose distribution to the target volume, and dose is prescribed on the isodose surface which just confirm the target volume. So, it is not point definition of point prescription. Now, we need to record the reference volume informations. Now, what is reference volume? Reference volume is the volume of isodose surface that just cover the target. Now, here you can see this is the target volume, red one, this is the target volume, and this is the treatment reference volume. This is the target, this is the tumor volume, this one actually tumor, and we give some margin and we will get a red one as a target volume. Now, this dotted line is the isodose surface which is just cover the target volume. So, we need to prescribe the dose in this isodose surface. If it is 80%, so we need to give we need to prescribe the our dose in 80% of this isodose line. So, if this line will get if we give suppose 30 gray, then this surface will get the 30 gray, and below this within this target there is more than 30 gray, and outside this isodose surface there will be less than 30 gray dose. So, this is the reference volume and the value we have set is 60 gray. Now, this 60 gray includes the dose contribution of the external brachytherapy, external beam radiotherapy which we have delivered by our teletherapy machines. So, normally the dose is divided is 45 in by external beam radiotherapy and 30 by brachytherapy. This is a conventional and anyone can use this combination, may be change, may be differ from institution to institution, from clinician to clinician, and for the requirement to get the good dose distribution to the target volume and to spare the normal structure like bladder and rectum. Now, what is the volume of this reference volume? This is DH. Here this dimension is DH, you can see, and this dimension is D width and this dimension is D thickness. So, there is a D height, D width and dt. This amount of volume we need to mention during the recording or reporting of this our dose specification of any kind of brachytherapy ICRU application of the carcinoma cervix. Now, in ICRU 38 they also mentioned that bladder and rectal points, and to identify the bladder we give the 7 centimeter square of liquid to the bladder as a contrast medium, and the we can the lowest point of this bladder is considered as the bladder reference point. This is the lowest point, this is considered as the, this is the point of this circle and or this sphere, and this point is known as the bladder reference point, because the rest of the bladder will receive the dose less than this point. This is the closest point to the implant. Now, for the rectal point, we can apply some contrast soaked packing, which defines the posterior vaginal wall. This is the posterior vaginal wall, and this is the applicators. You can see these are the intravaginal sources, means ovoids, and this is intrauterine sources, and these vaginal wall can be visible through radiograph by using the radio opaque liquid packing, and we can define this vaginal posterior wall. And 0.5 the center of the ovoid sources, we just need to define the center of the ovoid sources, and this come down to posteriorly, and 0.5% from the posterior vaginal wall will define the R1. This is the closest point of the rectal point, closest to the implant volume, and this volume, this point is known as rectal reference point. So, we have two critical structures, which one is bladder and another is rectum, and these bladder points and rectal reference points are mentioned and very much specified for by we can identify by anterior, posterior AP X-ray, and in combination with the lateral X-ray, means we can use the orthogonal X-ray to for identify or localize the bladder and rectal point. Now, here is a lymphatic trapezoid of Fletcher, and this is actually a trapezoid, and this trapezoid is we can define from the AP X-ray view, and from point mid L4 we need to give 2 centimeter lateral 2 points, and we need to identify the S1 S2 junction. From this S1 S2 junction we need to draw a line from the pubic symphysis, and this line, in the center of this line we can 6 centimeter both side, right lateral and left lateral, 2 points should be mentioned, and all this point if we join we will get a lymphatic trapezoid of Fletcher. These points are right para-aortic lymph nodes area, these are right common iliac lymph nodes, and this is left common iliac, and this is right external iliac nodes, and this is left external iliac nodes is mentioned in the lymphatic trapezoid of Fletcher. In the lateral diagram also we can identify these points. This is mid L4 means L para and R para, and this is the pubic symphysis and the S1 S2 junctions. We need to connect this one, and center of this line we can join the mid L4 and we will get the lymphatic trapezoid points. So, these lymphatic points should be mentioned, dose of this lymphatic points should be mentioned. And we have pelvic wall points, these are also identified from the AP X-ray film and lateral X-ray film, and these points, pelvic points dose are also mentioned to see the parametrium dose, or we can estimate the dose follow up of the implant. Now, in the ICRU 38 dose specification, the time dose pattern should also be recorded, and these time dose patterns means dose rate of the implant, duration of the implant, and the sequence of the application of with the to the external beam radiotherapy should be mentioned while reporting or recording the recording the intracavitary brachytherapy applications. And thank you all. This is all from today's class.